Hey everybody. Okay, I got some kind of weird thing that happened to me. It happened first in May, and it happened again in August, near the beginning of August. And I had some kind of liquid coming out through my belly button. And it did cause some pain. It had odor. The first time it happened, we let the doctor know, and he just had me go to where they clean wounds, and I was just told, to maintain it clean and clean it several times a day. It took about a month to heal. In other words, it took about a month for the liquid to stop coming out. Nothing was done at that time. When it happened again in August, I was not happy, first of all, and I really didn't want to call the doctor. My mom did, but I didn't. I told her that I wanted to go to emergency because I knew that in emergency they would at least do an ultrasound, because having odorous liquid coming out of your belly button and having pain around your belly button is not normal. So I went and I explained to the doctor that was seeing me that this had happened before in May, and that I was told that it happened due to lack of cleanliness, and I was not going to swallow this excuse again, because I clean my belly button. I clean it out. I make sure it gets dry. So I knew that there had to be something else, especially because of the pain that I was feeling. So they were checking me out. Obviously, squeezing the area made me get even more pain. It turned pink, my skin on the outside. I repeated several times that I'm a gastric sleeve patient, just in case there was something that they couldn't do, medication that they couldn't give me, whatever. And they asked me if part of the surgery was for my belly button, and I said no. So I was laying there, texting my mom, communicating with her what was going on, because they didn't let her go in with me, and she is my main translator. They tell me things in Spanish, and regular conversation I can somewhat understand, but when it comes to going to the hospital and things like that, I need my mom there, and they didn't let her go in. So everything that I'm letting you know is what I roughly understood. And I was texting my mom to let her know what was going on, that I was being checked, and that I wasn't even told anything, and I'm just listening. And I heard someone say, the person, that she was waiting on a surgical consult, and I started to freak out a little bit, because I was like, oh my god, another surgery, what is going on? And when the surgeon on call came and she checked me out, she sent me to get blood work, and she sent me to get an ultrasound done. When I got the ultrasound done and I was waiting for the results, I asked the technician, whatever you want to call that person, if he saw anything, and what I was told was that there was a small mass of liquid that could be seen, and that it looked like my layer of fat was kind of loose, and that it could have gotten infected somehow. Okay, I go back to emergency to see the surgeon, and sure enough, she said the same thing, that it was that the fat layer loosened, got infected somehow. She told me that the reason that she was requested to take a look at my case, and she in fact called another surgeon to also check me out. And I asked her why, and she said that depending on the amount of liquid that was going to be found inside me was going to depend if they were going to have to take me into surgery and take that liquid out. But that apparently the infection was not that big. There was not enough liquid to justify taking me into surgery. So that they were going to let me go home. They sent me home with antibiotics, painkillers, and I had to go back like 2 days later to be checked out. And then after that, just take the antibiotics and the painkillers and just wait for it to stop. The color of the liquid was like a creamy yellow. I actually had stuffed either cotton or wads of toilet paper in my belly button, because if I didn't do that, the liquid would get all over my underwear, and obviously it's an infection, so it smelled. When I finally saw my doctor, my gastric doctor, that month, I saw him like 2 or 3 weeks later, and I told him what had happened. He told me that the amniotic sac is always still attached to our belly button, even though it gets cut when we're born, but that there is still some remnants of the amniotic sac on all of us. And that apparently some kind of germs or something got in there through my belly button, and that's what got infected. And I was like, wow, okay. I didn't know that could happen. It's obviously something that's more accessible because of the weight loss. Even I noticed that it's a lot easier for me to dig in my belly button. So that's something that we have to be careful about. I did tell the doctor that I didn't like that I was being told that this is something that happens to a lot of fat people, a lot of fat patients, because I don't think that weight constitutes anything. I told the doctor that I didn't appreciate being told that I really think when doctors say that it's because of the weight, that it's a cop-out for not really finding out what's going on. And that I really felt that if I hadn't insisted on being checked out properly, that they wouldn't have found out what was going on, and they wouldn't have sent me with the proper antibiotics and pain medication. The bad thing about that also was that the antibiotics were huge, and the pain capsules, they were huge, and I was being told to swallow these. I used to, before surgery, be able to swallow 6 pills with no problem, and now 1 pill the size of an Advil gives me problems. I have absolutely no idea why this is. I even told the doctor I don't understand that, because I got operated on my stomach, not my throat. So I don't get it, but apparently that's what happened. Yeah, so infection is gone. It took about a month for it to go, and it hasn't happened again. So I'm extremely happy about that. Maybe it was just something, hanging around in there, and since I didn't have antibiotics the first time it happened, it was just something that was just waiting to come back out. But it hasn't happened since, so I'm really happy about that.